Welcome to Healthcare du Jour, where we dish up and digest the latest in healthcare. For the next 30 minutes, sit back as we bring you insight, commentary, and discussion on trending topics to the table, all expertly served up by our host and his guests. Healthcare du Jour is brought to you by High Tech Answers and Healthcare Now Radio, part of the Health IT Answers Network, and by the law offices of Myrick O'Connell. And now here is your host, Matt Fisher.
Welcome back, and thank you for joining as we dive into the hottest topics in healthcare. I'm your host, Matt Fisher. On the menu today is Dr. Geeta Nayyar, Chief Healthcare and Innovation Officer for Femwell Group Health. And I'd also like to say we were both social media ambassadors at HIMSS earlier this year, so it's great to see you again, Geeta.
Likewise. Thanks so much for having me on, Matt.
Yeah, no, thank you for joining. And I guess the way we usually kick off is if you'd like to give everyone a brief introduction and background as to who you are and what you do.
Sure, happy to. My name is Dr. Geeta Nayyar. I am the Chief Healthcare and Innovation Officer for Femwell Group Health. We are one of the largest MSOs here in the state of Florida. I run our data analytics department, our innovation department, and our marketing department. My passion is everything in innovation, everything in health tech design, and patient and physician engagement. I'm, again, very appreciative of the invitation today and really jazzed to be talking with you, Matt.
Yeah, no, it sounds like you only have a couple hats that you get to wear. I'm amazed that you can find time to do just one of those jobs.
It's busy but fun.
So, obviously I see that you have the MD. So, do you get to practice with patients as well, or is that off the table given all your other roles at this point?
Sure. So I'm trained as a rheumatologist. I practice very little. I'm a part-time faculty at Florida International University here in South Florida. So I do see patients and do some teaching when I'm able to.
Oh, well, that is amazing. It's I definitely know how much time that takes up. My wife is also a physician, so it's it's she loves seeing the patients. It's the part afterwards when you have to do the notes that it can be the frustrating part sometimes.
That's right. It's always the administrative stuff. I hope that you've had her on the show or you plan to have her on the show. I'm sure she'd be a valuable asset.
We'll have to see about that. Convincing her to do social things like social projects like this is not her favorite thing to do. But I think that's a nice way to kind of raise the topic which I wanted to focus on with you today, which is women in healthcare and not just in healthcare, I think, but in executive roles within healthcare and within the healthcare information technology field. Since I think there's been a lot of press about gender disparities and either the overlooking or the not giving the opportunities, which seems to be missing out on a lot of great intelligence and great thought leadership that's out there.
Absolutely, couldn't agree more. I don't even think it's about just the absence of intelligence. I think it's more about the stakeholders, right? Because if you look at what's happening in healthcare, it's really clear that the patient, the consumer, is more in the driver's seat than they ever have in the past. And what we know about every household, your household, my household, our friends, our family, we know that the first person everyone goes to when they don't feel well, they have a fever, they have a cold, their joints hurt, they're going to Dr. Mom, right? Forget everybody else in the household. It's always the kids going to mom. It's always the spouse going to, the male spouse going to the female spouse, our grandparents going to a daughter versus a son. So I think more than ever, the question we have to ask ourselves is, if the consumer is in the driver's seat and the consumer is either mom or mom is the caretaker, or again, the woman of the household is the caretaker of the household, why would you not have an individual that represents that at every level of your organization, right? Not just entry level, but of course C-suite board levels. And that's, I think, the missing opportunity for healthcare organizations that are not recruiting women, that are not looking for women leaders, and really mentoring and harvesting those types of employees.
And do you see, or have you experienced any specific strategies that can help to overcome that barrier?
I think there are any number, and I'm very encouraged by, the amount of, one, the fact that we're discussing this. I think the number of studies that have been done by HIMSS, by Xerox. If you look at today's Wall Street Journal, September 27th journal, there's an entire section about how men and women see the workplace differently. and the barriers and sort of the challenges that they face and the unique experiences that they face. So I'm very encouraged by, one, the awareness and the studies that are being done. I think internal, HR strategies are different at different companies, but I definitely think, number one, having a woman leader to lead this charge or to try to sort of aspire to is fantastic. I mean, you have to look at, for example, IBM CEO Jeannie Rometty, just a very inspiring, female executive also in the healthcare space. In Renewing of PepsiCo, very different from the healthcare space, but there are any number of C-suite leaders that I think is very encouraging for women of all industries to look to. Sheryl Sandberg, obviously, for obvious reasons, with the Lean In movement. So I think it starts with representation, mentorship, and any number of mentorship programs I think have value, whether you're doing lunch and learn, whether it's different HR policies with regards to leave around the time of childbirth, things like that. I think all of those are certainly positive. I think we also have to research those, to be honest, in terms of what works and what doesn't. We don't really know enough about what's working or what's not.
Right, and I think that's a fair point where you just said we need to find what's working and what's not. And to some degree, I think we don't want to lose sight of the fact that what works for one person is not going to work for the next person. That we don't want to lose the individualized element to it either, trying to arguably push one method over another and then inadvertently harm the efforts that way.
Correct, absolutely.
So it's and kind of also on your list of CEOs, there was, I don't know if you've seen the news, but it was just announced that Staples has promoted within, because Staples is in my backyard since I'm in central Massachusetts, and their headquarters is just a little bit east, and they promoted from within to have a new woman CEO as well. So it's seems, yes, no, it's but it is kind of interesting that your reference to HIMSS, and I remember what was it, a month or two ago, had the salary, the gender disparity or the gender-based salary report that came out, and there's also a lot of I've been seeing a lot of initiatives from there as well to recognize women in health IT. So I'm not sure, are you involved with any of those efforts, or do you have any connection with any of what HIMSS is doing in that regard?
So, my only connection there is I'm a former advisory member to HIMSS board, and obviously I'm a very big fan of the Health IT Chicks group, so in general I consider myself a proud member of that group, but no formal relationship with HIMSS. I'm just really proud that they did the studies. I'm also really jazzed that they are doing a new award this year at the HIMSS Banquet, the annual conference. They're doing the Women in Health IT Award. I think the fact that they are really bringing this to light is definitely fantastic, as I think many organizations are. I don't mean to, corner HIMSS. Certainly at Top Line ND, we think this is a very important topic. We're actually partnering with Xerox. We're doing a tweet chat for Health IT Week this week to talk about women in tech and very much bring this to the conversation during Health Tech Week. It's interesting to me, Matt, I think in my career path is in medicine, we see so many women. It's not a new thing to be a female doctor. Your wife is a physician. But when I transitioned into more of a health tech role, it's kind of interesting to me that it's so much more male-dominated, right? So I think that's, again, an opportunity in our industry. And as we think about healthcare delivery, so now, again, you have the consumer, which is very female. There's a very strong female role there. You have doctors that are increasingly women, especially in the primary care and pediatric space. But then in tech, which is supposed to be the technology enabling healthcare delivery, there's a huge disconnect because, again, it remains a very male-dominated field. So it's kind of an interesting observation just for me anecdotally through my career as well.
Yeah, no, I think that's I think that observation, especially being able to come from your personal experience, is interesting. So, as you said, given that we are seeing the delivery of medicine, and thinking about a delivery broader than also just physicians, but nurses and other types of providers, I agree with you. There's a lot of female representation in there. Do you see support networks or encouragement from that perspective that is missing within the tech or the IT side of things?
I do. I think we continue to iterate and do better. Again, the studies that you've seen being released the fact that we're, again, having this conversation, the fact that there is sort of a community that continues to grow, the Health IT Chicks group, along with many others. I think the way that we have to look at this is very similar to the way any individual or anyone in their career might go forward. I mean, I've personally, very much benefited from both male and female mentors. So I think anything that we do to make those relationships more attainable, more plausible, and help individuals that have a certain ambition or a certain talent, to your point, find a path to success and not give up for any number of barriers that might come, across their path. I think it's about acknowledging the dialogue, having the dialogue, and then coming up with a solution to the problem.
Yes, and I'm finding it very interesting, and you keep referencing back to like the Health IT Chicks community, which is one that I'm aware of as well, and have been honored enough to be allowed to participate to some degree. But that obviously the first place I saw that was through Twitter. So are you seeing that social media is assisting in breaking down the barriers or helping to level the playing field?
I think for sure. I mean, it's and not just for women in tech, but I think across the board. It's the fact that you have the ability to scale your network in a way that you didn't put a face, with a person or with the dialogue. I'll tell you, with Health IT Chicks, I think it's a big part of why we've grown. Actually, this was the first time we did a Women in Health Tech retreat. Actually, Max Stroud, put the whole thing together, tweeted all of us, organized all of us. We all, unfortunately, I wasn't able to attend this year because of scheduling conflicts, but folks, flew out there themselves, went on their own dime. There was no sponsor, or very nominal sponsors, I believe. So I think things in that vein. I mean, you had a group of people that were just hell-bent on meeting in person to have some of these conversations and to really solidify that network. So absolutely, social media is a way to improve this community as well as many, many others.
Right, and so I want to kind of pursue two different avenues based off of what you just said. I'm going to go off of what, more directly kind of where your response went, which is the point that it begins on social and online, but as you just said, having that in-person meeting that Max organized, that really, I think you don't want to forget about that piece of it. Correct.
No, absolutely. I think there's nothing like meeting in person, and I think social media is just an extension, again, of a relationship. But absolutely, there's nothing like in person. There's absolutely nothing like in person, but we all know that that's tough to scale. So I think social media is just one way to augment and, again, solidify. And to be honest, it also, sometimes I could email someone, I could text them, I have their phone number, any number of ways I can message them. But sometimes when you see the avatar on social and you're constrained to the 140 characters, there is kind of a comfort or a safety in just making the ask and saying, hey, could you help me with this? Or, hey, I wanted to ask if you would do this, that, or the other. And it's kind of a safe harbor as opposed to leaving a voicemail, waiting to see someone call you back, someone having to take 20 minutes out of their day to then call you, to then, so it's interesting how social is changing the way we interact, but also helping us cut to the chase in a very fast-paced life.
Yeah, you actually just answered the question before I could ask, which was, what do you see are the primary benefits that we can find from social media? And I think, as you just said, the removing that hesitancy to ask for help or input and being able to, as you just said, cut to the chase, I think is really a huge one. And then also, as you mentioned a minute ago, just the fact that you can create a network that is likely much broader than you would be able to have done in the past when you were, I don't want to say limited, but where you were reliant more upon, running across people at a conference or your more immediate community.
Correct, right. And even for introductions, people are, more willing to introduce you on social. It's easier to throw in a couple of tags and make the introduction as opposed to a formal email, a formal. People are much more amenable to cutting to the chase and making the ask in a sort of safe, non-promotional way.
Yeah, so now that we've kind of talked about those benefits, do you see that there are drawbacks still as well? I'm going to just, coming from the legal perspective, I always perceive that there's going to be some negative to something just because I'm always thinking about the worst possible outcome. But with social, what do you, kind of coming back to, what do you see as some of the drawbacks or some of the potential negatives out there?
Sure. I think that like anything in life, right, it depends on the individual. I think there's harbor and safety in in being anonymous. There's dangers with being anonymous. I think also, whether you're getting an honest answer versus a, publicly facing answer, I think so you always have to take things with a grain of salt. When we think outside of healthcare, we consider, things such as bullying and things such as, everyone appears to have a wonderful, great life on social, but what's the reality? So I think that there's pros and cons to any number of methods of communication, whether it was, social or otherwise. So I think that just has to be, an understood sort of risk that you take when you're out there.
Right.
Safety, security, cybersecurity, those things are, not small things, but I think again there is a place and space for different things in different venues.
Right, and I definitely agree with you, and I think that as you said, the anonymity that can be pursued, because obviously, knowing your presence on Twitter and other places, and then thinking about my own use, I put my face and name behind everything I'm doing, but there is a significant utilization segment out there that doesn't do that, or even if they're not doing it anonymously. I think we've all seen instances of what we'd probably consider cyberbullying or other activity that would view as not productive.
Correct. That's absolutely correct.
So in terms of that kind of that bullying aspect to social, do you think that there are particular groups that might be, I don't want to say more prone, but more likely to be subjected to that type of activity that could discourage use or could hinder all the benefits that we've been talking about?
So I think all of us tend to think of children, right? I think that's the main group that's at risk, right? It's the children, it's the vulnerable, those that may not know how to step up, or again, different minority groups that might be, perhaps more vulnerable to a community or crowd sorts of mindset. I think parents have to be careful. I think schools have to be careful. I think we as communities and neighbors have to be careful. If you look at what's going on around the world, the recruitment by ISIS of people on social media. I mean, you can find evil in any place, out there in the world. So I don't want to say that that it's just social media. I mean, I think we all lend ourselves to being vulnerable in different spaces and just have to be wise and smart. And I think at home you have to be really careful and communicating with your children, making sure devices are, device policies not just at work but at home as well, and social media policies at work and at home. I think it's important in this day and age to talk about those things and monitor those types of things as well.
Yeah, no, I think those are very fair points. It's obviously we're all, as you said, we're all used to the policies when we're in the workplace, but remembering that we should have those lines in personal life as well is something important to remember.
Yeah, for sure.
Yeah, no, it's so kind of, I think shifting back probably a little bit in the conversation. I know, as you said, one of the things that you mentioned that has come out to help shed light on some of the gender issues are a lot of the reports, especially with HIMSS, and then again, not to kind of keep picking on them, but other media outlets as well, talking about pay disparities. So I didn't know if you would like to be able to kind of dive into that a little bit and talk about about the current state of where things lie, and then what actions could be taken to help improve what is the unfortunate current state of affairs.
Sure. I think the gender inequality, the pay inequality is absolutely unacceptable, right? Equal pay for equal work. If you have a male cardiologist and a female cardiologist, there should be no difference, right? And that goes whether it's a C-suite executive, an entry-level role. It's absolutely unacceptable, and I think it actually starts with the individual. It's much harder to change an institution than an individual, and I think too often, even as an executive negotiating with employees, I sometimes want to kick some of the women under the desk to say, you didn't even ask. You didn't even ask. right? So I think a part of this is just the training of the individual, letting men and women know, one, that they can ask, two, they should ask, three, recognizing that you want to ask a little more because you land in the middle. I mean, there's all kinds of tactics and strategies. And I think we also have to be really mindful in our institutions, with our HR policies and our own HR training, because this idea that a woman that asks for equal pay or for, a bonus that is very entitled, the idea that that woman would be viewed as more aggressive, in a negative light as opposed to a man, it's just unacceptable, especially in an environment now where you actually have so many women being the bread earner for a household. So you as the bread earner are now sort of even more handicapped because you have a family that's depending on you in a way that maybe historically hasn't happened, and on top of that, your employer is not giving you a fair shake. I think we also have to be really mindful of a lot of women that work part-time get paid part-time but work full-time. And they work part-time because they want to have a family and work and have this balance, but often employers actually take advantage of that situation. And the woman is, not standing up to say, hey, this arrangement is not what we discussed, and I need to be, compensated, or I need to truly have this mark where I don't pass.
Right. So, kind of breaking that apart into a few pieces, in terms of what you said about the negotiation, and as you said, you're in the executive role, so you're kind of on on the side of establishing what will be paid to the employees. How is the employee supposed to know, or can they know, if if the male is starting at a higher level as opposed to a female who might arguably be starting at a lower number to begin with? Because just thinking about my own experience, I don't talk with any of my colleagues about what my salary is. So it's, to me, I don't know if that's different in different workplaces or if it is kind of a black hole that that each person comes from.
I mean, I think in every organization those numbers are meant to be confidential, but it's about going in with knowledge of the studies that we're talking about. Again, the Wall Street Journal say, fantastic article. You need to know, I mean, you can Google, what a doctor in South Florida should make if they're a primary care doc, a specialist, a nursing care doc. It's the same for any number of roles. You need to educate yourself on what is fair market pay. I mean, that's the bottom line. And I guess especially for me, with my doctor hat on, again, and thinking very much a doctor is a doctor, right? And again, obviously, depending on experience, 5 years of experience is different from 15 or 20 years, but it kind of surprises me that even with physicians, that the men are more likely to negotiate, the women are less likely, and it's a very comparable role. So, sometimes I am disappointed, and it's even more disappointing. On the other, it's a little interesting for me being on the flip side, making some of the decisions, but always feeling that, gosh, there is a disparity here. There is a disparity in what we're paying a man or a woman, and I think that's something that's also incumbent on our HR professionals in those executive roles to also, ensure certain bands or, market value. There has to be some standard also that the employer has to be held to. I think that that's also very important.
Right. Yeah, and actually, as you just said, holding the employer to a standard kind of leads to what I was going to ask, which is, since the employer obviously can see that spread of information, what should the employer be doing to help to normalize the negotiation stance or the negotiation tactics that different people apply?
I mean, again, I'm not an HR professional, but I would imagine that there's all kinds of training that should be done. There should be an analysis done on, certain pays at certain levels. I imagine there's, certain bands that they would use for things. But I think this is very much, something on the HR side that has to be enforced, and not just enforced, but it needs to be a priority from leadership that HR enforce that.
Right. So, unfortunately, I do see that we're starting to bump up against the end of our time, but I'd like to kind of just ask one closing question, which is, in light of, everything that we discussed and kind of all the different initiatives that we're seeing, where do you see these efforts, and where do you see, kind of equality going within the next year or so, or I guess whatever the appropriate time frame you'd suggest is to hopefully move that ball closer to each other?
Sure. Well, I mean, we had our first presidential debate last night, irrespective of your, political affiliations. I think it's fantastic that we have, for the first time ever, a female presidential candidate. I think that's a sign of the times. I think that we're going to continue to see things like this. I personally have a 4-year-old daughter. I love that I could, show her the TV and just say, hey, could be you, right? So, yep. And it's just, I think not underestimating role models is really important. And I think if we see more and more women in those roles, and other women that are able to say, yes, that could be me, and especially in education as we look at STEM programs. I think it's really important for those of us in the industry to go to school, go to our kids' schools, being a role model, having a conversation with someone. You'd be surprised where planting a seed can go, and I think that the future is very bright. Again, the fact that we're having this conversation, I think we will continue to push the envelope. I think we have a long way to go to equality, but like everything else that's hard-earned, the reward will ultimately be there and be reached.
Yes, no, I definitely agree with you that it's the future does hopefully look very bright, given, as you said, all the seeds that are being planted with, as you said, the different role models that are now more in the public light that every young child can be able to follow, and also just the programs that are available. But as I said, I can't believe that we're already out of time. I want to thank you very much, Geeta, for joining today.
Thank you so much, Matt. I really appreciate it, and I really think you should ask your wife to come on the program.
As I said, we'll check with her on that. And as things continue to develop, I hope we'll be able to have you back in the future as well. And thank you also to everyone who is listening. If you want to keep the dialogue going and connect with me, look for the hashtag HCDEJURE. And I'm Matt Fisher. Until next time.